Please subscribe and hit the bell icon so that you will never miss any video from Acuere Life Science Foundation. Myself, Dr. Shantanu R.Joshi, a clinician, a pharmacologist and a drug researcher. Dear students, today we are going to discuss about blood-brain barrier. What is this blood-brain barrier? Is it any anatomical location in the brain? The answer is no. Then what it is? The blood-brain barrier is the very specialized arrangement of capillaries of the brain, where the intercellular pores are very small. The junctions of the two cells are very close to each other, and that's why the opening in between these two are very less, you can see. And further, there is investment of the neuroglial cell above it. Already the junction is tight, and plus there is investment of the neuroglial cell over it, making the junction more tight. And that's why these capillaries allow very few substances to pass to the brain. It do not allow all the substances to pass to the brain. Which substances will it allow to pass to the brain? And the answer is only lipid soluble substances. Only lipid soluble substances from the blood can pass to the brain. And that's why higher is the lipid solubility of a drug, more will be the entry into the brain and more will be the effect of the drug on the brain. Lesser is the lipid solubility of a drug, lesser will be its entry in the brain and lesser will be its effect on the brain. If the drug is not lipid soluble, it cannot enter the brain, will have no effect on the brain. To discuss all these things, we will take the simple example. First example will be of aminoglycosides. All of you know, dear students, that streptomycin was the forefather in aminoglycoside group. Then gentamicin is there, amikacin we are currently using much more in the market. In the patients of meningitis, you cannot use aminoglycoside by IV route. If you are using it by IV route, it will not move to the brain. It will not penetrate the brain tissue. It will not penetrate the meninges. Why? Because aminoglycosides are highly ionizing molecule, highly polar molecules. More is the ionization, lesser is the entry into the brain. And that's why in case of meningitis, though we know that mostly the meningitis is due to gram-negative microorganisms, typically bacterial meningitis, still you cannot use aminoglycoside. If you want to use aminoglycoside, you should give it intrathecally, that is directly into the spinal cord. The second example I would like to discuss with you regarding this blood-brain barrier is neostigmine. Neostigmine is a reversible cholinesterase inhibitor. The neuromuscular blocking agents, the effects of the neuromuscular blocking agent can be reversed by using this neostigmine. We regularly use it during anesthesia when we want to revert the patient. We use neostigmine. But the same neostigmine cannot be used in the patients of atropine poisoning. For example, some patient took dhatura seeds for the purpose of, say, suicide. The poisoning of dhatura is equal to the poisoning of atropine. In this case, we cannot use neostigmine because neostigmine is typically a water-soluble product and cannot pass to the brain. And that's why in case of this atropine poisoning or the dhatura poisoning, you need to use physostigmine, a very close molecule. It is also a reversible cholinesterase inhibitor, but physostigmine is fat soluble. Being fat soluble, it enters the brain and can reverse atropinization which took place because of that Dhutra poisoning, Dhutra seeds poisoning. The third example I would like to give you is of Parkinson's disease and use of levodopa. All of you know that in Parkinson's disease there is deficiency of a neurotransmitter dopamine in the brain. Then simply you may think that if there is deficiency of dopamine in the brain, give dopamine. But you can't give dopamine in the patients of Parkinson's disease. Why? If you are using that dopamine by IV route, it will not pass to the brain because dopamine is typically a water soluble product. Then we have to use a precursor of dopamine, that is levodopa. Levodopa is a precursor of dopamine and is fat soluble. Then we use this levodopa. It will move to the brain, it will enter the brain. As it's a fat soluble, it will enter the brain. It's a lipid soluble, it will enter the brain. And after entering into the brain, a process known as decarboxylation takes place, and that levodopa get converted into dopamine. And that is real effective drug in the patients of Parkinson's disease. In Parkinson's disease, you cannot use dopamine directly. You have to use levodopa. That levodopa is fat soluble, that will enter the brain and will give the results. My dear students, like this blood-brain barrier, there is blood CSF barriers also there. The drugs which cannot enter the brain cannot enter CSF. And one more important thing I must add in it is known as enzymatic barrier, brain enzymatic barrier. The capillary cells on their surface are rich in some enzymes. For example, monoamine oxidase, choline esterase. This monoamine oxidase disintegrates catecholamines. Adrenaline is a catecholamine, noradrenaline is a catecholamine, dopamine is a catecholamine. They are having catechol nucleus in their chemical structure. The brain capillaries are rich with monoamine oxidase. When these drugs, the neurotransmitters, come in contact with it, it will degrade it. And that's why these substances like adrenaline, noradrenaline, dopamine, isoprenaline directly cannot enter the brain. The same way, there is choline esterase in a rich quantity. It is available on the surface of the cells of the endothelium. That choline esterase can degrade acetylcholine, and that's why acetylcholine also cannot enter the brain. And so some other chemicals, some other enzymes are also there. This is known as brain enzymatic barrier. My dear student, in this blood-brain barrier session, we should also consider one important topic related to CTZ. Stands for chemoreceptor trigger zone. First, I must explain to you what is this chemoreceptor trigger zone, that is CTZ. CTZ is an area in the brain which can be stimulated with even a minor change, minor chemical change in the blood. This area, when stimulated, patient gets nausea and vomiting. We can also call it a vomiting center. Even a minor chemical change in the blood can stimulate this center and the patient will get nausea and vomiting. I am telling you these all things in the blood-brain barrier session because this is the only area in the brain which do not have blood-brain barrier. All other areas of the brain do have blood-brain barrier except chemoreceptor trigger zone. Chemoreceptor trigger zone do not have blood-brain barrier. And that's why even the water-soluble drugs, even the water-soluble products can pass to CTZ and can bring about stimulation of it and can produce nausea and vomiting. And that's why while reading the pharmacology book, in most of the drugs, you will get the first side effect of nausea and vomiting. Because every drug is ultimately a chemical. It produces some chemical change in the blood and that is sufficient to stimulate that CTZ. And that's why the common side effect of most of the drugs is nausea and vomiting. while writing in the exam, do remember antiemetic drugs do not have the side effect of nausea and vomiting. Thank you. Dear all, thanks for watching. Please like and subscribe so that you will never miss any video from Acuere Life Science Foundation, Pune. Thank you.